Hello everyone, I am Dr. Abbas and I manage Geriatric Care Aid Center at Noida 3 location, which is one of its kind under the direct supervision of American India Foundation. As you know, the year 2020 has been designated by the WHO as an International Year for the Nurses and Midwives. And so today we are going to talk something about the challenges they feel at their workplaces. So I have asked some of my students, I have asked some of the other nurses as well, and I find out what challenges they feel. So the answers were concentrated in four following. For example, it was they said that there was a lack of motivation is there. They said that there is a feeling of low energy. They say that feeling of frustration is often there, and they say that emotional exhaustion is often there. Surprisingly, when I see all four of these collectively, these all are the symptoms of nurse burnout. You know, nurse burnout is a widespread phenomenon and it is usually seen everywhere in the world in the nurses and midwives. Now the challenge is how to cope with that and why the nurse burnout is taking place. First of all, I would also like to tell you, if we see in a country like India, we see there is a huge shortage of nurses and midwives, and it is often associated with the work and personal conditions. For example, it could be work demand that exceed the resources. It is poor working conditions with inadequate staffing and often double shifts. There is increase and long working hours, and there is a very low salary structure in our hospitals for the nurses. There is no recognition, there is isolation from the family, and there is lack of performance-based incentives. So you see, there is a huge shortage as well as high demand for the nurses. So you see, there is a very large gap in between. And to compensate this gap, we all have to work together. We all, including the government, including the people, including the community and the hospital administrations, and everyone has to work together in a very fast pace to tackle these challenges. Here, I would also like to appreciate the efforts done by NADA India NGO. For example, their initiative has done a lot of efforts which is named as Young India Initiative for Healthy India. They have done following things. For example, they supported the nursing assistant with the training in leadership, which is a very important aspect nowadays. Second thing, there is no emotional support, as there is a lack of motivation and there is a lot of frustration in their jobs. And what NGO is doing, NADA NGO, is providing them emotional support via technique like eCPR, and sometimes collectively they called as VCPR when they train more than 2 or 3 nurses at a time, and hence they are empowering the nurses and the midwives. Similarly, like NADA India NGO, we all need to act before this gap even increases more. So what we need, first point, invest more in the nurse and midwife-led services. We need to make nurses and midwife as heart of the primary health care, which providing services and supervision in the community health workers. We need to support nurse and midwives in delivering health promotion and disease prevention. There should be performance-led incentive. There are no incentive for these nursing staffs. There should be mental support and care for the nurse and midwives. And last but not the least, I would like to say we should invest in leadership skill of the nurses and midwives. So I would like to end the video with this end note. Remember, we need more of them. So please take care of them.